National Disability Center for Student Success. We are thrilled to have you here. Our foundational course video today is Disabled Students on Campus, and find the latest findings in higher ed of what you need to know. And we'd like to see your experience and see how we can support each other and support students. So the agenda for today, we have 4 key topics. And the first is really thinking about and understanding disability itself. It's very complex, and I want to unpack that concept, what disability is and what it looks like in higher ed, on higher ed campuses and in programs. And then we'll go through some data that there may be some misperceptions about disability enrollment in higher ed and students' experiences and student success in programs and curriculum. And then the third thing we'll talk about today is accessibility, things that you can do to create accessibility for everyone within higher ed, post-secondary institutions and programs. And we'll think about those post-secondary programs. We'll think about how some of those programs are 2 years. Some are private, some are public. There's technical training, all sorts of things. So we want to provide options for each of those. And then the last thing we really want to emphasize is your role. Everyone has influence. Everyone has opportunities to support disabled students. And so those are the topics we're going to cover. And then we'll have your call to action. How does your role or your position, what steps can you take in that, in the short term and long term? A little bit about me. I'm here at the University of Texas at Austin. I'm very excited to be in a new role as the director of the National Disability Center. And that is accredited by the Institute for Educational Sciences. I'm also a faculty member here in educational psychology, specifically in special ed, and I have a special appointment in special ed. So I'm very excited to be here. I do teach courses related to the culture of disability for a variety of students from different backgrounds. And so I'm thrilled to share some of that background with you and the work from the center, the research we're doing. And then the last thing is I recently released a book based on the same topic, Disability is Human. And that book really covers stories and data, how to think about disability in general, both on campus and beyond. Okay. The central question that we're starting with today is, who are disabled students on your campus or in your program? Who are they and how do we know? So we'll cover some of that with data and also with stories. First, we have the US Census tells us that we have around 21% of students on campus who have a disability. So that's about 1/5 of students, and that aligns with many of the data we see that officially recognize students with disabilities, students who have accommodations or are in the process and have disclosed that on campus. So the good news is that has increased over time. So if we look at the same data from 2008 and compared to 2021, we see it has doubled. That's an awesome statistic, awesome increase from 2008. And so in 2021, you can see here the recent percentage, but this is great news. So this can mean a few things are happening. One, we know that we have a lot of programs, a lot of institutional support. to help students transition from high school to post-secondary program. And that would contribute to the increase in the number that we see here of students who are attending college. So I'm hoping that is having a positive impact. And then the second thing we know is that more students are identifying as disabled. For example, ADHD. We've noticed an increase in the numbers just in general, and that includes those who attend college. And then the last thing we know is that more students have disabilities, especially within mental health. The percentage of students with a mental health disability in this setting has increased. And so that is another reason why we see this increase over time. And the percentage of students with a disability has gone up. The number of students in college with a disability has gone up. Okay. And now I want to share with you some of our centers data. So it looks a little different. If you notice on the bottom, you can see a logo there. That's the center's logo. That means this is data from us and not the US Census. So this is our data. When you see a logo there, then you know that is data from us. Recently, just last year, we sent out a survey across the country. And it's not nationally representative, but we got a good sampling from each state of over 500 people. And so we asked people to share their identification. So if they have a disability, we also asked about mental health, if you have a chronic health disability. And then when asked directly, those three things, up to 44% said they had a disability. Now that number is almost double what you see in the general US Census in that data that we saw. So it's not that it's wrong or right, but I think what it means is that students with a disability, when asked directly about a disability, are more likely to identify as disabled. Maybe they do perceive themselves as having a disability. So it may depend on the definition. So we can look at these categories. We had several categories on our survey. We had ADHD, autism, mental health. And then you see the most occurrence in the mental health. From around 500 students who responded, you see 60% say yes to mental health. And that's a lot. Remember that each student can choose more than one. So we'll talk about that more later. So it's not just each student could only pick one. So you can see the bars is every yes response. And then you notice here we have neurodivergent. That is not an official category on many surveys, but many students, many younger people today do identify in that category. They'll say, yes, I have ADHD, but I am neurodivergent. And so that's more identity-based. And so when we surveyed, students told us we needed to add that category. So we did. When we piloted it and then we got that feedback, we added that because we thought it was very crucial to include what disability means to them. Okay. So now a little bit of a deeper dive. You can see that many students said that they have more than one disability. So the infograph here, you can see 46% chose one, and then 26% chose two. And you can see that a high percentage chose more than one. 15% chose 3 disabilities. So for me, I look at this and see, okay, disability is more complex than just one category. So in data for K through 12, we see typically a primary disability and then an additional or secondary disability. And when we share data about disability in K through 12, we typically only see one. We see a primary. We don't see the complexity and we don't see the intersectionality. Right? And so then we just group it and say many people with a disability is in the standalone category. But it depends, how do people perceive themselves as having a disability or not? And half of the time, it is more than one disability. So when we design services, we need to be thinking about multiple disabilities. Okay, so that's a little bit about what we know about disability. Maybe your campus has a different way of collecting information or data, but I just wanted to let you know what we're starting to learn here at the center. Both the higher numbers and that it's more complicated, more complex than what we typically see. So when you're thinking about your students, your trainees, what we know about disability is typically related to what they tell us, what they disclose. When a student says, I have a disability, I need support. Most of the time, disabilities are not visible or apparent. Remember that? Disabilities are not obvious to most people, most of the time, which means that students must disclose and approach a professor and share that and have that be documented for people to really understand and to know what disability they have. So we have more information about disclosure now. Okay. When we ask students about disclosure, we didn't say disclose one thing. We said three, or we included 3 things. We said disclose to your friends, maybe in the dorm, or if you're an athlete, do you disclose to your teammates, their social network. And we see that rate is the highest here at 65% when we surveyed those students. They said, yes, I disclose to my friends. Sometimes it's more functional, like I need access to something and I can't if I don't disclose to my peers. Sometimes it's more about relationship building, wanting people to know each other and to empathize, and they decide to disclose. And the second category is instructors. And so that means without an official letter. I mean, typically you see students maybe passing the class without that help or disclosure or accommodations. They like test the water to see if they can pass the class. And then later they realize, ooh, this isn't happening without support. So then they disclose to the instructor and say, I might need extended time, or I may need some support with an assignment, And so it happens often through real time rather than that official letter at the beginning of a semester. And we see here that over half, 57.5%, disclosed to instructors. And then you can see some students here go to the office for accommodations. And then the last category we see, did they disclose to the college? Which means through the ADA office for students with disabilities. So an accommodation letter, documentation, and all of that process, it may involve interviews, notes. And what's surprising there is when we think about disability in general for the student population, we're thinking about half went through that official process. And when you read and research about disability within higher ed, it's really important to know, how do we define disability? Because if you're only talking about students who went through the official process, we're overlooking so many people. And now you can see why in these 3 instances. Okay, I would like to share this quote from a student with you. We did many interviews over the past year, and I want to make sure that we share with you the kinds of experiences these students were sharing. So the quote is interesting because it tells us many things about disability that people may not be aware of. So she said, when I first went to college, I didn't know that my mental health was considered a disability. It was very surprising. I didn't know mental health would be considered a disability. That's very common. Many people think like wheelchair or hearing loss, but they don't think of depression being equal as far as the category of disabilities. And so that's a misperception, or just some students just really do not know. And then the second thing is I didn't know I qualified for accommodations and support. And so what are the accommodations? So some confusion around disability, but then also the accommodations and that journey. And then last, she said, they have helped me out tremendously. So we can see that accommodations really can have a positive impact on students, but we encourage them, they have to disclose, encourage them to communicate. When we did a spotlight, well, like when we see what the institution is doing, we reached out to several students and we encourage them to consider sharing about disability, right? And don't think you can't qualify, but it's important that you get the support you need. So that's really key. Is some students' experiences is so varied and complex. It's not a one size fits all. And that means when administrators or service providers, like when they think about access or support, we need to think about all of these things and have that open mindset. So for example, if a student came to college training program with an IEP or with documentation or 504 plan from high school, they're in a different position from someone who now is still trying to figure out, do I have a disability? Do I qualify? So those are very different scenarios, and we want to make sure that we're reaching out to everyone and meeting them where they are. So thinking about the disabled student's experience, first understanding it, and then understanding the complexities and that there are so many different backgrounds. One thing that I always try to remember here is that it's really like the importance of intersectionality, that concept of multiple identities, right? And the discriminatory experiences. Disability is not standalone. Many students experience discrimination from their disability, but also types of discrimination as well. So if you consider that intersectionality, you see the complexity and that some disabled students experience, it's not the same as they're not all the same. It's not one size fits all.
So the next question for you all to consider as we go through this, how accessible is your campus or your program? What is your role? What is your involvement to ensure that those spaces are as accessible as possible and that your services are supporting a learning environment? When we interviewed folks, we interviewed administrators, faculty, staff, students, and common themes that showed up across these interviews was that many people know that they have resources, they have initiatives, they have programs, they have the accommodations office, but those are all siloed initiatives. So from a student's perspective and a student experience, one office had support for one respective area, and then another office had support for another respective area, and they didn't consider access for extracurricular outside of classroom activities, and where one instructor said yes, another instructor said no. A lot of internships that were taking place out in their fields of study were not provided accommodations for. The payment structure was very complex and confusing. So when you think about the effort that these resources are available, but it's impacting students in a way that doesn't support them because they are siloed and these students are having to chase these different avenues, and many of them get to a place where they just give up. So how can we figure out where those silos are and what we have so that they can then be centralized and working more together? So this is another quote from a student, and I want to emphasize this point here. This has to do with mindset. Before knowing what to do and how to prepare folks to think differently, they have to have this accessibility mindset. So this quote said, allowing for an open dialogue about these issues is important so that students don't feel shame or face any issues regarding accommodating our disability. And that word shame came across everywhere. We saw that through and through each interview, students feeling this perception of shame or like they were being looked down upon, and that the request system with instructors, just the whole culture of disability was involving shame. And sometimes that has to do with internalized ableism. That could be the case, but it also parallels the experience that we see within campus programs. So students clearly said that creating a space where it's okay to speak openly about what you need is important, and to feel like there weren't limitations when it came to talking about and describing what it is that they need. So shifting that perspective for students as they navigate the accommodation process and accessibility. We have another example here, another quote from a student. And this is really talking about the gaps between instructors. So across instructors, the variance of responses and how many people, how many students they interact with in one semester. So say we have one faculty who is accommodating, allows submitting of late assignments until the last day of class, for example, providing that flexibility. And then on the other hand, having staff or professors who are adamant about not providing accessibility, not allowing for accommodations. And you can kind of see frustrations on both end. You can see where receiving no's across the board does not allow for that accessibility mindset. And sometimes there's not one statement for everything, but it's also about how the student perceives what's going on. If they're not receiving flexibility in this arena, they have frustration around that. And then there's also frustration around the difference in faculty and staff and expectations across each individual, because there is no standard policy for what each instructor expects or what each faculty member expects. And so it's negotiated over and over again, which requires a lot of energy. And it comes down to having to chase their access. Now, the last quote we have here is from a faculty member. This is Dr. Andrew Dillon. And this individual is part of our center team here. And I thought this was interesting with this quote. He says, I thought I understood the idea of really designing with people in mind. like that particular area of expertise, and that's his area of expertise. However, he says, I was so naive in my understanding of people and accessibility. Now, that's very common to see across faculty, that they mean well, they have good intentions, but they don't often understand what accessibility means within their area of study. They just don't know what that looks like. So how can we help them process those pieces? So I think here for Dr. Dillon, when we think about shifting that mindset and coming to that realization, we can build from there. We can build from that foundation. And I think it's really important to realize how faculty needs to wake up and kind of be aware of what it is they don't know. Okay, so we have a bit of a complicated map here on this slide. And from an administrative perspective, this talks about the administrative perspective, student perspective, and faculty perspective. Now, often when you think about the journey for students from an administrator's perspective, you think about their experience at the institute within the curriculum, and you can see these blue markers across this map. Those are key indicators of success points as they enter into systems and enter into certain experiences within an institution or a curriculum. So some of these areas, such as the application itself and the admissions process, how do they navigate through that with the accommodations office and receive support? How much time, and looking within our COVID time span, we had months of waiting for some of these areas. How much documentation is needed? How many resources are needed? That's a lot of time, effort, and energy. And then we look at self-advocacy, and this is a crucial piece because self-advocacy is a part of all young people's experience growing up. Nobody arrives to a post-secondary educational environment without having built that foundation of self-advocacy. Now, for students with disabilities, that adds an additional layer on how to support their development in that area. So how do we process that with them? Through support groups, or are there folks available to provide mentorship for these students? Is there a cultural center of some kind that supports self-advocacy development and understanding the experience of students with disabilities? And then what factors within this context lead to success and allow them to pursue graduation in these environments, within these groups of folks, if we look at these different markers? Now, the purple dots on the bottom, you can see potential areas of kind of atrophy or withdrawing. So moving away from the system, if you look at what we see here, it's called summer melt. That idea, you may be familiar with this concept. This is when students apply, they are admitted into an institution or post-secondary environment, but then they don't enroll. So they don't show up, even though they've been admitted. They don't start. They get ready, but then they don't start. So what happens in that period of time? How do students with disabilities experience that summer melt? And what are the contributions leading to access in regards to accommodations, in regards to disclosure, and all of those pieces that we've talked about to get those students ready? What are those potential factors that are contributing to summer melt for students with disabilities? That's just a genuine question that we don't have enough research around. So I genuinely ask folks what they think there. That second category in the purple dots, you'll see the concept of accommodations and support and lacking in those areas. So maybe It's provided, but it's not exactly what's needed for each content area or each respective student, or perhaps there's a training experience that doesn't have enough flexibility for accommodation. So what happens there when we see that gap that leads to withdrawal from a post-secondary environment? And these are just areas to consider key entry points and key withdrawal points for students with disabilities in this particular context. So we have another story here, another quote from a student, and this student says, "Unfortunately, my college doesn't really provide access to student club meetings. Sometimes there's a person who's willing to write some notes and explain what's going on, but the university doesn't provide support for those organizations because the student organization, there's a payment issue." So the first thing here is the student does have accommodations. They've gone through the process. Those accommodations are only available for classroom settings, not for extracurricular or outside of classroom environments. So this student does have full access within a classroom setting, but doesn't have access to external clubs. We also see the issue of payment. So who pays for the service? Is it the student organization? Because it's likely that those organizations don't have funds appropriated for that service and they can't afford it. So considering how we figure out where access happens for students so they can develop the skill sets that are needed. And all of our research shows that extracurricular organizations are just as important for developing leadership skills, soft skills, mentorship. It's not solely the classroom curriculum content that supports development in these areas. A lot of this is also taking place outside of a formal classroom environment. So why isn't access being provided there as well? So now what can we do about this? I've provided some options, both short-term and long-term, in terms of what you can do, you alone or with a team. Some things to consider. Consider how disability is defined, how it's experienced, and how it's understood on your campus. So, like the example that was provided about mental health disabilities and how students perceive their mental health, either as a disability or not, and they question whether or not they qualify for accommodations and services. Also, nowadays, a lot of young people say that they are neurodivergent. So, what does that mean, and how can we understand what they mean with that terminology? And how can that be incorporated in a learning context? What does it look like to design a classroom that is flexible and accommodating for those students as well? Spent a lot of time thinking about designing learning spaces, and in future webcasts, we'll dive into that content a bit more. And then other things you can do is you can think about identifying where your strengths are and opportunities for access. Like we've talked about, a lot of campuses work in siloed environments. So if you have resources or efforts taking place across your campus, how can they be pooled together? Like we've mentioned, people are working really hard. How can that be centralized so that energy can be working together? We often see large campuses with complex curriculums not understanding what's taking place in each respective silo, and it's just not a good use of time and energy or effort across the campus. The third thing that we think about is invitation. My work shifted when I invited disabled students to lead me through their experience, to lead me through their understanding. We need authentic invitation where we want to learn from these experiences. And sometimes that means compensating people for their stories, honoring their time through payment, honoring their energy with compensation, and figuring out where that takes place and in what context. And in regards to bringing people together, where can stakeholders also participate and provide equal opportunity and reduce reduce the gap of the power dynamic amongst stakeholders and those who are in charge? So where can we create a safe space to share opinions and to share experience where everyone feels heard and understood and like there's a consensus? The fourth thing to consider here is alignment. Our institutions have strategic plans. We know that that's a requirement. So how can we align with the understanding that students with disabilities are also a part of this plan? They're a part of everything. Not only students, but also faculty and staff who have disabilities on campus. For today, we're talking about students with disabilities, but when we think about student success and student initiatives, how can we incorporate those students in a way that they're a part of the collective? And within our current initiatives, how can we all work together, working smarter and not harder, leveraging what it is that we have in front of us? And then the sixth thing that we see here is data. We need more research. We have metrics that we've developed over this past year at the center. We are researching metrics for accessibility, for students, for faculty, and staff. So you can use those same metrics to adapt to your specific environment and see what people say when you ask them directly about accessibility in their learning environments, whether it's virtual, a hybrid, or an in-person environment. Surveying and asking a variety of questions to help you gather information about disability and disability identification and what their experience looks like for them from an intersectionality perspective. So the last thing that we're going to touch on today is you can subscribe for updates. We have updates that we disseminate. We also have a learning hub that is on our website, and you can bookmark that learning hub for your resource. We often add resources on a monthly basis. We have tags based on interest areas as well, and you can filter to ensure you're getting exactly what you need from that learning hub. And the third thing that you can do is you can join the communications network. So the purpose of this is to expand on information sharing. So we share with one another the things that are taking place in our organizations, across our campuses, within our research, within our thought leadership. We share what's taking place and we cross-train and cross-disseminate so we can improve together. And that's all available on the website as well. Okay, so I will stop here with my presentation. Thank you for your patience with me as we worked through all of this. Thank you to the interpreters up to this point. So I'm looking to see if we have any questions here in the Q&A or any thoughts that anybody would like to share. So one question I see here is, do teachers share their own experiences with accommodations or providing accommodations so students feel more comfortable with disclosing? That is an awesome question. One thing that we do see lacking is an awareness of disability within the instructor population, within that staff. So when instructors share their experience, from me, speaking from a personal experience, I've seen many students be thankful for sharing that experience, and they feel encouraged and that it was helpful to hear that they're not alone and that their frustrations are shared and we can discuss strategy together. So I think that's a really important point when instructors can be that resource. And if we can develop that respect and support for how that is shared, that can be invaluable. The second thing that we know about FERPA is that sometimes instructors don't know what to do with the accommodations. So, volunteer note takers, for example, that's a tricky one because we can't say who the notes are for necessarily, but sometimes that process forces a disclosure that isn't necessarily appropriate. So figuring out if we can have a note taker in the classroom for everyone. So it's not singling out any one student with a disability, and it provides more equitability rather than a disabled student feeling like they're the only one needing this resource. So both supporting faculty and staff with disability and also figuring out ways to make the accommodations a universal process and not just based on one individual needing to make that request. That's a really great question. Thank you.
Do we have other questions? Let me see. One thing I did want to mention briefly. Yeah, one thing I did want to mention is that we have a spotlight for the Institute's initiatives. And we recently had our first one, and we emphasized Canvas, that learning management system. It's a learning management system, like Blackboard, Canvas, and thinking about how to make sure that those systems are accessible. So here at UT, we had a huge shift in how we think about that. And the spotlight really emphasized stories of what happened in the past and students' experiences. We had some legal issues pop up and around supporting students' needs. And so, how can we train faculty to make their PDFs accessible? Right. And then, or also in regards to PowerPoints or captioning, you name it. So, that first spotlight was really an important example of how, these initiatives really impact everyone. Thank you for your question and have a good day wherever you are. Thank you. Bye bye.